Okay, this is one of my face pain, trigeminal neuralgia face pain treatments. And I have patients who have a similar problem, which is neuropathic pain syndrome, trigeminal neuralgia. It doesn't matter. Migraine, TMJ, it's all treated the same. Because the mechanism of action is the same, the pathology is the same, the treatment is similar. You just have to customize it based on the circumstances. So this is me treating my trigeminal neuralgia, and it's zygomatic, and I just put needles in, and I can't see what I'm doing. Because I'm looking at myself in the video, so I can't. So I gotta just go by feel. So I'm doing my masseter, the whole thing. I'm realizing that the facial nerve comes out this area and it fans this way. The trigeminal nerve is more internal. So the facial nerve is probably much more susceptible to being inundated by the muscles and the crushing action. So I am going to release all of this. I'm doing the sternocleidomastoid. Masseter, and I'm going to get to the temporalis in a second. I have to get a mirror here. The masseter is a very dense muscle, very dense. And if you don't release it, it will compress all of those, the distribution of the facial nerve across here, and it'll give you a shock. And this is the way to release it. I'm also doing the zygomatic major, minor, orbicularis, because you never know which muscle is the culprit. It's not nerve, it's muscle. The muscles are active, the bone and the nerves are passive. So I'm going to put them in and just let them. Also, this orbicularis and the muscle around the eye. I can't think of the name right now. Orbicularis oculi. And I have to sneeze. Some of these needles will trigger a reflex, a cough or a sneeze. Most times it's a sneeze with me. Or your eyes will water, your nose will run. It's amazing. This is my pattern that I've discovered, and so this is one pattern. There's another pattern I use here, and there's another pattern that I use down here. And I get somebody else to do my back. I can't reach it. Because all of this works as a unit, you can't really say which muscle is doing which. It doesn't matter. It's not your job. Your job is just to treat all the muscles. Once you treat all the muscles, then the pain goes away. It's pretty tender there. See how that's grabbing? That is a super sensitive spot there. When I touch it, it goes up to like a 7. So I'll just let it simmer, and I'll mess with these others. So as I do this on a patient, they'll just say, oh, or give me some signal, and I'll pause. So the mechanism of action is stimulation. So once you get that high level of feedback, you just pause and let the Mother Nature quiet it down. And then once she quiets it, you can go deeper. That's a good one. There's some resistance there, and it's stuck. Oh, there it goes. And you don't know what's there until you reach in and feel what's there. And once you feel what's there, it's called feedback, and there's nothing you can do with it. It's just log it. There's no cause and effect. Sometimes there's a muscle and a point that you can say, oh, that's the exact point. A lot of times it's not. Your job is just to stimulate. So I'm going to let these simmer, and I'm going to do the second part of this in a second.